Do you have a child or client with attention problems? Maybe they are darty, maybe you just cannot get their attention for more than 2 minutes to actually teach them things. Today I'm talking with Dr. Jamie Hughes-Lika, who is a wealth of information. She's been a behavior analyst for more than 2 decades, like I have, and she has a lot of really great tips and a whole cheat sheet of ways you can use regular items in your house to build attention. So let's get to this really great interview with Dr. Jamie Hughes-Lika. We have Jamie here. Thanks so much for joining us today, Jamie.
Thanks, Mary. I'm so excited to be here to chat with everyone.
Yeah, so we knew each other online for maybe the past year or so, but I don't know you well, and I'm excited for to get to know you better and to have my listeners get to know you better too, because you're a wealth of information. So let's jump into your fall into the autism world.
Absolutely. So I have been doing this a hot minute. So I've been a board certified behavior analyst for ages, and I've been working with children with autism and supporting families for over 28 years, which is just crazy to me to think about this. So I, like most professionals, got into autism in my college days. So I took a course for a psychology undergrad, and there was an internship that I could do to get extra credits to volunteer to support a young child with autism or autistic child, however your learners prefer to talk about it. And so I went in and I did in-home ABA type programs with this little guy. And I just loved it. And I've never done anything else professionally but support autistic children. And so that has been really how I started out. And then I moved into becoming a BC ABA back in 2001. Then I went to grad school and studied under Cooper, Heron, and Phil. Just they're just amazing. So I went to Ohio State University, did my master's there, learned a bit more, really got into verbal behavior through a private study that I did with Professor Coop, which was great. And then my journey has just continued to morph into more naturalistic types of intervention as I focus on more and more young children. Then I moved to England and did a PhD focusing on parent mediated interventions for young children. So supporting parents to help their children in their in-home settings. And then I just kind of lived around the world and came back. And now I'm sitting here in Iowa, and my journey has morphed a bit. So 4 years ago, I had a son who is the best thing in the world. And he started to show signs of speech delay and some characteristics of autism. So now I really get to see it from a twofold approach. The professional work that I've been doing as a 28-year veteran, right? And now as a 4-year veteran parent to supporting a young child with some bits and pieces that were a bit different than what we were expecting and different than what we anticipated. And so really focusing on bringing in all of this great knowledge and experience from supporting families for so long to bring that in to actually help my own little guy at home.
Nice. And how is Liam doing now? He's 4 now?
Liam is 4. He's doing amazing. He's doing well. And one of the topics that we're going to talk about today is all about social engagement. So focusing on social attention and motivation. And from the early days, as soon as Liam could start crawling and he could get his hands on an item, that's when we started to notice some sticky attention. We started to notice he wasn't responding as much, didn't orient around as much because he was distracted more so than, again, that he should have been. And so we started to notice some other things. And because he has a mommy who does this for a living and who supports young children, it was pretty clear to me that there were some things that we could do to help support him, to kind of bring him back out, get him unstuck. I think you have something unstuck, get started, right? Getting him unstuck on what he was focusing on and bringing him back into sharing those experiences with us because we were noticing he was starting to not do that as much. So he goes to preschool, he's doing well. We're working on some really important language work to kind of clean up some articulation issues, maybe see if there's apraxia, doing some work with Tammy Casper about supporting him. He has a history of hearing issues from tubes and chronic ear infections. He has tongue tie issues. So there's a lot of that medical stuff that also comes into play.
Yeah,
But
yeah.
it's great. Yeah.
And I do have a podcast, a previous podcast with Tammy Casper, who's an SLP BCBA, and we can link that in the show notes, all about apraxia. And um, yeah, um, a lot of work on all of these areas. Even I have, I think, a video blog or something on tongue tied, which is, a big thing for many children. But it doesn't matter if a child eventually has a diagnosis of autism or a diagnosis of apraxia or speech delay or anything. Um, as soon as you notice um, attention issues, joint attention issues, is when you should not become worried or frantic, but you should be constantly trying to engage a child. And it's so much work. Um, it's hours and hours and hours a day. Even people with kids with autism say, well, they go to ABA therapy or he goes to preschool, 3 mornings a week. Or we have a couple hours of early intervention. And really, studies show that all kids, even kids without a diagnosis of autism, but especially kids with a diagnosis of severe language problems or autism, they need to be engaged during most of their waking hours and with the right skills and the right order. And most of waking hours is like 80 to 100 hours a week, which sounds
Exhausting.
absolutely like impossible, right? So today we're going to talk about motivation and attention, first of all. Like, what are we talking about there? Because, kids on the spectrum actually have a lot of attention to details, to parts, and that's sometimes why they um, line up things or hyper focus on things. So let's talk about attention. um, what's typical attention? When should we start looking at it? What's a 3-month-old, 6-month-old baby supposed to be doing in terms of attention?
Yeah, absolutely. And you and I, since we've been supporting the autistic community for so long and live in it ourselves, I think one of the things that really comes to the forefront is looking at some of those social attention and social motivation differences that we see. So we know that a lot of young children from early, early days, they orient towards people's faces, their voices, their bodies, infants. But we know that some of our children that we support aren't necessarily doing that. There tends to be more of a focus on the non-social, the objects and items around them, as opposed to really kind of connecting with the social, the people. And so, like you said, we can get stuck on items. We have a hard time shifting and switching my attention from an item back to a person, even if that person is playing with me. So, those are some of those joint attention differences that we see. There are issues sometimes with children imitating other people. Imitation is a two-step process. You need to watch so you can do and copy. So if we have children that aren't orienting towards us or our actions or their peers around them, their siblings, they're missing out on opportunities to copy and do what those children are doing, because that is such a powerful tool for learning, imitation just in and of itself. So when we think about how children might play with toys, again, if you are kind of stuck over here playing with toy with a hyper focus, you might not be attending to the other ways that people are playing with toys, different ideas, creative ideas, which might impact some of that flexibility. I play with it this way because I don't notice there's another way to play with it, not just because I prefer to play with it that way. And then when we get into thinking about nonverbal communication or using gestures and pointing and throwing our hands up to generate some ideas or convey a message, again, if children aren't attending to what we are doing from a social perspective, they're missing out on those really, really important foundational skills, which are gestures and imitating and pointing and reaching and showing and sharing. So all of those behaviors that we see with young children, older children.
That come in naturally without anybody teaching them, which is amazing to me, right? But though all of those behaviors come in naturally, and when they don't come in naturally, then what do we do?
Then we want to put some strategies in place to do that. Thank you. So
Right.
that was kind of that, hey, we noticed this happening. These are all social in nature. They're things that might hold our kids back or they might have difficulty kind of learning from us. And this is how children learn. They learn from what's going on around them, right? That's where you get the most bang for your buck. So if the kiddos that we are supporting or our own children aren't doing that, we want to think about strategies to help them get there. So if we looked at social motivation, social attention, social engagement, there's a great research article we don't have to unpack, but essentially, what do we mean by social motivation, right? That's kind of this idea, this concept. Would they do a wonderful job of breaking it down into social orienting, so having children respond to us, not to items, to us socially. They then talk about social seeking, which is about children initiating, approaching us to get something, show something. And then that very third talk tier that they talk about is social maintaining, this back and forth reciprocity, or this I do it, you do it, we share it, we show it, and we enjoy it together. So I love that article that came out because it just summarized, oh, if my kid's not responding to me, I need to focus on that. If my child responds to me really well, but I notice he never spontaneously asks me for things or shows me something or initiates with me, here's a bag of strategies to help with that. And then those two behaviors kind of come together to make up this maintaining, this back and forth. He'll show me and he might respond to me, but then we don't get that connection for longer periods of time. We kind of tend to drift off. So all the strategies that I do and the techniques and tips and tricks out of my bag really come back to supporting parents to identify what does that social motivation and social attention look like? Because if we can support that, we're going to get social engagement.
So, so if you have a 1-year-old or an 18-month-old who is not showing, who is not pointing, pointing with your index finger, pointing not only to reach for something they want, but also to show you something. There's two types of pointing. I've done a video blog on it. We can link it in the show notes, but to show you an airplane in the sky. And somebody explained this once. I didn't read it in a research article, but pointing to the sky to show you an airplane going by. Um, it's kind of like they know their imaginary line going from the tip of their finger all the way up to the airplane is pointing and with this imaginary line and also referencing over to mom or dad or brother to show you. So it's not just pointing in the sky by themselves. It's also referencing and wanting that would be like your third step of like
Mhm.
maintaining, showing, sharing, and the enjoyment. Like,
Mhm.
look, there's an airplane. But there's a whole lot more. I like what you said, Jamie, about imitating as a two-step process. So if you're not sitting and watching someone, you're not gonna then do the second step. And I find that like when Lucas was little, he was very darty.
Mm.
A lot of kids,
My flitter
their
just kind of
parents,
butterfly
parents, yeah, they're just darty,
everywhere.
you won't even sit down for a second to look at what you're doing to try to copy, maybe. And
Mhm.
also these skills if you have regressive autism or you lose skills, which Lucas did, like he used to clap, he used to wave, and then he stopped. So you also have to be like, have we seen them cooing back and forth lately? Or have we seen them pointing not just once 3 months ago, but are they pointing a lot? But
Yeah.
say you have a child who is not pointing, showing, sharing. What are the techniques to support parents? And I know you were able to watch some of my toddler preschooler course and um, so there are techniques in there, but I'm sure you could summarize the techniques in a minute better than.
I'll try. Yeah, in the course that you have, it really outlines what to teach and kind of what order. And when you're talking about, like you said, that airplane example with the string going up there, we can talk about like dyadic engagement, where it's just an interaction back and forth with me and a child. That's where we need to start. And then we can bring in that triadic, three things, me, the child, and an airplane. If we don't have a child attending to us socially back and forth, there's nothing for them to reference when we get to triadic, when we get to the third item, bringing in a distracting object or an activity, right? So it's really important that we have a good assessment or a course that we can rely on for parents to kind of guide them with what should they be targeting and how best to support the child, really meeting them where they're at now. And then when we think about some of these great strategies to help enhance social attention and social motivation, um, and the field that I'm in within kind of naturalistic developmental behavioral interventions, which is just really blending ABA with some developmental principles. We talk a lot about the child's attention, like stepping into the spotlight, right? So, where is that child's attention spotlight shining? Is it
Mm.
on the book? Is it on the car? We want to be in that spotlight with them. So, we want to position ourselves close to them in their comfort zone. We want to be animated. We want to be in sight at their level, right? Getting a kiddo to look all the way up at us as really tall humans is a lot of effort. And for some children, it's too much effort and they don't do it. If we can bring ourselves down and really position our faces, which is where all of this great information is coming from, it makes it easier for them to start dialing into us. So just stepping into the spotlight is a great way to do that. That is getting into what's that child's interest, what's their attention on, how can I be a part of it so we can support them. So that'd be number one.
I love that. And if you think about, okay, a child is very into spinning a top or lining cars up. I love what you said about like we're very tall. So like get down on the floor, lay on the floor. They're laying on the floor, you lay on the floor next to them, but don't try to disrupt their thing right away. You
Yes.
know, you should be whatever you add should make that play more fun. So
Yes.
a lot of mistakes I see is parents laying on the floor and then they're taking the cars, which is causing the child to have a meltdown. You know, just lay there, be
Yeah.
like beep beep, or add some more. Here's another car. Let them line it up with you. Oh, beep beep, or you have your set of cars. Maybe you're lining up a whole set to get down into their play schemes, even though it is really more like stimming. Even if they're, repetitively making the tires go, have the car upside down, making the tires go, you have to start somewhere. You know that's really, and they also like 1, 2, 3, 4, 5. 1, 2, 3, start counting as they're spinning or anything to be like, oh, I'm not just focusing on the toy, I'm focusing on somebody's face. And now, oh, she's actually making it more fun, not less fun.
And we talk a lot about being a play partner versus a play director. And that's exactly what you're talking about. The adult who comes in and hijacks that attention and motivation. We're going to push the car this way. I think for a lot of us, we haven't played with toys in a long time. Like, right? It's been a hot minute since my childhood, trying to think back of how I used to play with toys. And I think we all have these preconceived notions of what we do with toys. And that's different depending on your experience, your culture, how you played with toys. And for children with autism or autistic children or speech delays, they might have a different preference. So when we think about how children play, the flow or the interest, the schema, it ebbs and varies throughout the play. And we want the children that we support to have that same creative experience. And if we are going to sit down there and meet them on the floor, that's where they're at. That's what we do. I know I have a harder time getting on the floor, but I'm happy to get down there and join them. And there is a ton of research that shows imitating a child's behavior is a great way to get them to attend to us socially. So I spin wheels, I push cars, I make sounds, But my intent is not to stop there. I want to scaffold or kind of extend. Okay, what else can I do that spinning motion is fun, like you said, and share it with the child so they notice that something is different. I've connected with them. Great. Now I go back and follow their lead. It's kind of child-centered. But I don't just sit there and spin wheels over and
Right.
over.
Right.
Nothing against it. But I want to make it intentional and I want to make it connected to me. And so when I talk with my professionals, I talk about engagement. But when I talk from a parent to a parent, I think about being connected. How can I connect with my child on any level? I have to kind of get into where they're at and meet them where they are, and then slowly kind of work from there. I
Yeah.
know you have seen this example where it's a choo-choo train or something, and the kid's playing with it, and then that therapist or adult might pounce. What's it say? Make it go. And the kid is like,
What
yeah,
color is it?
I'm out of here. It is not, it's looking and smelling like work. That's not play, right? So I love the NDBI kind of stuff because it brings in that D, that developmental play, relationship-based focus. We need structure, adult-led activities, but we also need to really recognize and honor, that child's autonomy and what they have an interest in, and recognize they're little, their attention span is short, their emotional regulation not quite developed yet, right? They're little people with big emotions. And if we come in guns blazing, being a play director, that's a great recipe for a tantrum.
Even for kids with higher language abilities, I find that um, the way to pair with kids who are conversational, talking in phrases, almost conversational, the way most people start out a therapy session or start with a new client who has language is a bunch of questions and a bunch of bombing in and pouncing on their way of play. And it's like, really limit the questions, really just be on the side. Like even you sitting next to the child may be an aversive if they have had, kind of aversive therapy in the past and they're um so we have to assess where the child's at,
Mhm.
regardless. And I have an assessment. I have a digital assessment that's called the Barbera Early Childhood Assessment, the Becca. We can link it in the show notes. That gives parents, it's best to do it as a parent or as if you're a professional, do it with the parent. It takes about 10 minutes. You'll get a good assessment. You'll get areas of strengths and needs in both in self-care, in language and learning, and in problem behaviors. And we're seeing quite a bit of great pre and post transformations with the Becca. I have big plans for that in the future, but we have to start where the child is at. I have a
Mhm.
bonus video. I have video blogs on how to teach pointing. We
Mhm.
want to do it in the most natural way, but I'm also a big proponent on building up table time, which table time to me is not table time to 99% of the people listening. Table time to me is a mixture of natural environment, motivation, attention. I find that like sanitizing a therapy room and having a child sit happily at the table and focus on my face because I'm holding things up and having things disappear into a shoebox so that we can work on the next thing to focus on really can build the parent skills, the newer professional skills and the child skills. And once you see the child start responding, everybody gets a whole lot more motivated to
And animated. Absolutely. And that's a
going.
great strategy to kind of get into that child spotlight. The spotlight's on that shared activity, putting things in. Play schemas. A lot of children like to enclose and envelop activities, right? That's a great activity to do. As you put the card down, your face is there, and you can animate your sound effects as it goes in, or animate the gestures, and really getting the kid to kind of dial into, again, all of us, which is social stimuli, getting them to dial into people and their actions and words, because that's where the learning is going to happen. That's where all the teaching is coming from. So I think we have those attention getting spotlight strategies that we can adjust, turn the dial up and down. And then, like you said, within that context of us kind of working together with the child, we have this positive affect, which we kind of talk about as like getting the smile. So, what is that child's motivation and how do we keep them there? We know attention is closely linked to motivation within the social area. So, we want to have both of those pillars there. So, doing different things with our bodies to really have this affect rich shared experience is what the research tells us is how development is occurring. If we have children who tend to maybe not seek that out as much or are busy with other activities and really focused on something different where they're okay if we're not really a part of it, that presents a barrier that we want to try to figure out how to go under, over, or around to getting them to come back and meet us where we are. And so we can help support them where they are at. That environment that we are trying to facilitate for learning is social, right? Conversations are between two people, imitation between two people. Everything that we do to support somebody else has a social nature to it. And we know that a lot of children with language delays, autism, and other issues are having a social breakdown, right? That there is something that is just off that we want to support. So we want to bring them back into the fold of what we're doing and try to support them that way. So those are just some great strategies to think about how to increase our energy, imitate the child actions, change our facial expressions. We're really just wanting to play around with some of these cause and effect. What does a kid do if I whisper? What
Mm.
happens if they really get animated? For some children, that's too much. They don't like it. So we need to be aware of that and pay attention to it. Sometimes our physical actions can make an activity an interactive activity. And then for our flitters, as I call them, the ones that are constantly flitting from object to object because they have a hard time kind of getting into it. These are some great ways to help them stay a little bit longer so we can teach a little bit more. The shoebox is a great example of that.
Yeah.
Focused activity with an
And
object.
and the materials you use to put in the shoebox, familiar people, reinforcers, pets, characters from their favorite TV shows, like really try to think like if I gave you $1,000 for your child to stay for 2 minutes or 5 minutes and do the shoebox program and have you hold the item or the picture up to your face and have them look at you and not eye contact look at you, just body oriented. Um, be happy, like I'm sure you know of Miss Rachel, and there is a danger for sure of too much electronics. But I did do a podcast episode on the techniques that Miss Rachel uses, using that animated slow tone and also video modeling, and I can link that in the show notes as well.
Yeah, I'd
Um,
love to see that. I haven't seen that one
yeah,
yet.
yeah. So, but I think you and I, Jamie, are very much on the same page in terms of we need to get kids' attention. We need to motivate them, and we need to motivate parents to keep going. Because when you see progress, even if you get a mama or you get an I love you, um, that is so motivating, and it motivates everybody to just keep going and keep working at it, because being a parent of a child with a speech delay or with autism or even typically developing kids who might hit bumps in the road or might have medical issues and need ear tubes or have some kind of, chronic medical condition. Wherever your child or clients are at, we need to meet them. We need to really help them reach their fullest potential over the years, um, the months for professionals that are going to work with them, and then the years for the parents. So we're not going to solve all the problems in a 30-minute podcast episode, but I do want to pivot quickly to, you have a great handout that we're going to link in the show notes. It's using 20 common household items to encourage play. And you've got, like using a stick or using closed Tupperware containers and different ways you can use it. Like a stick, you could use it as a pretend guitar. And maybe your child's not ready for a pretend guitar, but maybe they like music, or you know they could use a real guitar and you could use a stick to make a little band
Mm.
just to kind of push them a little bit.
Yeah, absolutely. I think because I've been supporting families for so long, and know that I also am a parent of a young child who is a flitter who likes to move around quickly. I've had to really stay on my toes to stay ahead of him, to think about how to keep him engaged and keep that social attention and motivation. And I also realize, we live in language-based learning environments. We don't need materials that are super expensive to buy. They might be good for some things, but we are really trying to, again, meet the child where they're at and support parents in everyday activities and routines. So we're not asking you to kind of carve out time. We really want to push into that to support that. And I like to pick items that people can find in their homes. Most people have mismatched containers. I know I do. Tupperware. Those are great. You could stack them into towers and then make an activity. And we'll talk about how to structure that activity in a minute. We could do that. We could put beans or sound maker sounds, like bells and other things that will kind of jingle and make noise if the child doesn't put things in their mouth for safety purposes, right? So we could do that, and we could shake them, we could drum them, we could spill them out, we could dump and scoop in them. We can put them, the lids on our feet and skate around the house with them. There's just endless opportunities to the things that we have with blankets, pillows, laundry baskets, empty boxes. And those are things, again, that I think most parents would have in their house, but maybe they've never looked at it as a vehicle for how to sneak in some teaching and support some learning and really connect with their children. And these types of things that are new and novel, right? The kids never really played with them, are great attention getters because they're brand new. Like, oh, this is cool. I can think of nothing worse than those VTech toys that light up and make whistles. I don't do that. I work really hard to animate this, but I have sound effects, but not like that. Just as you mentioned with the electronics, they're just a big spotlight stealer, and they really make it hard for motivation to shift back over to me. And so all of the items that we have in our house are available at your hands, right? And what can we do with them? And then it's just really sitting down, maybe making a list of, I've tried the drum game on the plastic containers. I took them outside, we put rocks in them from a nature scavenger hunt. And we just make a list, dry erase board on the fridge. What did the kid like? Did he like that? What can we do to maybe see if we can enhance it? If not, move on. Not everybody likes everything, right? Everybody has their own preferences. But if we can find out what it is that might help capture that child's attention and motivation, we can start to build these connections with them. Bring in things from your assessment that are important to support them on with their skills, and sprinkle in some of those strategies to keep that learning going. So it's a super fun visual that you guys can have up.
Yeah, and we're going to link that in the show notes. And also along those lines is not all kids, especially kids with autism, are going to be able to tell you, I really like that, or I didn't like that, or they're not going to have a big problem behavior over it to tell you that that's not what they liked. So in my son is 28 years old now, and he has language, but he is not a good he can't really tell us. I love that. I hated that. I'm bored now. I'm just not into it today. So we actually have a data sheet that the behavior analyst and I work together to create, that we measure his affect. Like, is he smiling? Does he have a good affect? How many prompts does he need? Um, does he have any minor signs of agitation? And so, not that everybody has to get a full data sheet, but be on the lookout, like Jamie said. Did he seem to enjoy it? Would he enjoy it better with musical instruments inside the container? Would he like rocks? Um, would he like to bang on it? Um, so it's a great handout. I just took a peek at it. So we're going to link that in the show notes. Also, Jamie, you do some consulting with professionals at your doctoral level behavior analyst. I don't know if we mentioned that in the beginning, but you have a vast knowledge and you train professionals now. You do some individual coaching with professionals, but you have a website. So what's your website?
Yeah, it's sagelearningsystems.com.
Okay, we'll link that in the show notes as well, so anybody can check that out. And before I let you go, part of my podcast goals are for parents and professionals to be less stressed and lead happier lives for themselves. So do you have any stress management or tips for stress reduction?
We live in Iowa now. We were in Vegas before. Nothing grows there. So now that I'm in Iowa, we started gardening. So we have a little garden out back with some tomatoes and green beans, and that has been tremendously therapeutic to water, pull some weeds on a really rough day, and then get to enjoy the fruits or vegetables of our labor. So that's something that we just got into that I find very reinforcing and entertaining because I never thought I would be gardening. So that's my go-to.
Awesome.
Liam comes out and picks everything and we point to it. It's a whole thing.
Yeah.
He loves to cut it. He won't eat it, but he loves to cut it and kind of wash it. So that's one thing that I do that we do
Nice.
together.
Nice. I think that's great. That's great. All right. Well, thank you so much. We're going to have all those links in the show notes. It was great to get to know you better, and thank you for all your knowledge. And we're going to have that great handout as well. So thanks so much. Take care. And I'm sure we'll be collaborating and in touch in the future as well.
Thanks for having me. Thanks, Mary. Bye, everyone.